Hello. My name is Jones, and today we are going to look at inflammation. Okay, so inflammation is a sequential reaction to cell injury that neutralizes and dilutes the inflammatory agents, removes exotic materials, and establishes an environment suitable for healing and repair. So inflammation, it's simply the body's reaction to an injury that results in a resolution from the insult or the assault that happens to the tissue, and also the repair of the tissue. Okay, so inflammation is always present with infection, but infection is not always present with the inflammation. So some of the causes of inflammation includes infection itself. Okay, heat may cause inflammation, radiation may cause inflammation, trauma, chemicals. We have corrosive chemicals like acids and the likes. They may cause inflammation. Then we have allergies. Then we also have autoimmune reactions that may cause inflammation. The intensity of the response depends on the extent and the severity of the injury, of the person that is affected, and also that person's capacity to respond to the factors that is causing the inflammation. It can be infection, radiation, or chemicals. So the immune response of an individual will determine the extent to which the inflammation might reach. So the inflammatory response can be divided into four. So that is four phases. There is the vascular response. Vascular response here, vascular, looking at blood vessels. So vascularization, we're looking at vascular response. Then there is the cellular, we're looking at the cells, cellular response. So our interest is to do with the cells, that will be involved in inflammation. Then 3 is a formation of exudate or exudate formation. So that is phase 3. Then phase 4 is healing. So let us now try to understand each of these phases separately. And also appreciate some of the necessary interventions that can be done within these phases. So when you're talking about the vascular response, what necessarily happens is that after the causative agent has been brought within this individual's environment, there will be some kind of cell injury that will happen that may lead to local arterioles being briefly go under some vasoconstriction. So after that cell injury, we're saying the local arterioles. Now, arterioles, these are the smallest arteries, smallest blood vessels, so the arterioles. So after cell injury, local arterioles briefly undergo some transient vasoconstriction. After the release of the chemical known as histamine and other chemicals by the injured cell, vessels then dilate. So from vasoconstriction as a reaction to the injury, and then chemicals are produced, bring about vasodilation. So chemical mediators cause increased capillary permeability and facilitate fluid movement from capillaries into the tissue spaces. So the reason for the vasodilatation is to increase capillary permeability, so that whatever is needed to go and fight the infection that is causing inflammation, or the trauma or chemicals that have been brought within this person's environment, so there will be increased vasodilatation, so that there is increased permeability. So initially when someone has suffered an injury and there's increased permeability, there will be some serous fluids that will go into the tissue spaces. Okay, then later on, inflammatory exudates are going to accumulate within this tissue space. Okay, then we're going to have plasma proteins, and we're talking about plasma proteins here. Primarily, we are looking at albumin. Okay, so these are going to pass through the now increased permeable capillaries into the tissue spaces. So these proteins are going to exert exotic pressure that further draw fluid from blood vessels. Both vasodilatation and increased capillary permeability are responsible for the redness, heat, and the swelling that is seen at the site of injury. Okay, so because of increased blood flow at the site of injury, we see the reddening. Okay, because of vasodilatation, we're saying we see the reddening. Now, blood carries with it also some warmth. Okay, blood carries with it some heat. So there will be increased heat at the site where there is inflammation. Okay, so with increased permeability within the artery, this will cause some edema, or it will cause some edema at that area, or bring about some inflammation at the site of injury. Okay, so in a vascular response, we're saying initially there is vasoconstriction as a reaction to the cell injury, and then after the release of histamine, okay, there will be vasodilatation. Vasodilatation happens to increase permeability of capillaries. When capillaries have become permeable, they will allow plasma proteins like albumin, okay, serous fluids, and other inflammatory exudates, okay, the cells that come to fight the infection within the tissue space are going to pass through these highly permeable capillaries. Okay, so that is what is happening in the vascular response, from vasoconstriction to vasodilatation. That comes because of histamine. Then we look at the plasma proteins that may come out, and other cells, okay, that may come out from the vessels into the tissue spaces. Okay, so with the vascular response phase explained on inflammation, then we can now look at cellular response. So now here at cell level, we're looking at cellular response. Okay, in the previous phase, we did not want to go into details about the cells that are passing through these capillaries that have now become highly permeable. So the neutrophils and monocytes are going to move from the circulation into the site of the injury. There is what we call chemotaxis, okay, which is a directional migration of white blood cells to the site of injury that result in accumulation of neutrophils and monocytes at that site. So at the site of injury, we are going to have monocytes that are going to migrate, okay, and this will happen in 6 to 12 days. Then we have monocytes that also migrate, that is in 3 to 7 days are going to migrate to those areas. Okay, so lymphocytes alive at the sites later to promote and induce hormonal and cell-mediated immunity. Okay, so they were alive in order to mediate this. So we are looking at lymphocytes, neutrophils, and monocytes coming in or playing a role within the cellular response phase of inflammation. So we have said there is chemotaxis And chemotaxis, we have said, it's a directional migration of white blood cells, okay, that result in the accumulation of these neutrophils and monocytes. So when neutrophils alive, that is on the 6th or 12th day, okay, they are actually the first to arrive at the site of injury. So when they come at the site of injury, they phagocytize, from the word phagocytosis. So they phagocytize or engulf the bacteria. Other foreign materials and damaged cells also with the short lifespan of like 24 to 48, okay, they will be engulfed within this area. Okay, this is an effort to neutralize them. Okay, so dead neutrophils are now going to accumulate within this tissue space. Okay, in time, a mixture of dead neutrophils, digested bacteria, and other cell debris are going to accumulate as a creamy substance, which we term as pus. Okay, so when we are looking at pus there, it is just accumulation of neutrophils and monocytes, okay, that have engulfed bacteria at that area, and they die within that process. So if the neutrophils are needed, okay, to further fight infection within this tissue space, the bone marrow is going to release more neutrophils, and at this time it may release matured and immatured neutrophils into the blood. When you do a full blood count, you see that there will be elevation of white blood cells, okay, and especially the neutrophils are going to be elevated because of chemotaxis, which try to promote the migration of these neutrophils to this area. So white blood cells, what we call neutrophils, are going to increase in a full blood count. Okay, then for the monocytes, okay, these are the second type of phagocytic cells that migrate from circulating blood, and as we have indicated, they are alive at the site within 3 to 7 days after the onset. The monocytes are transformed into macrophages, which phagocyte the inflammatory debris. So when monocytes reach the site of injury, okay, they are transformed into macrophages. These macrophages then phagocytize the inflammatory debris. The macrophage role is important in cleaning the area before healing can occur. Okay, so we have talked about at this cellular response phase, we have talked about neutrophils and monocytes and the role that they play. Then we can also look at lymphocytes. Lymphocytes are alive at the site later to promote or induce hormonal and cell-mediated immunity. Okay, so chemical mediators like complement system, that is C2 and C9, okay, are activated. So when you're talking about complement system C2 and C9, it's a group of coenzyme cascade consisting of pathway to mediate inflammation and to enhance phagocytosis, increase vascular permeability, chemotaxis, and cellular lysis. When cells are activated by injury, the arachidonic acid in the cell membrane is rapidly converted into producing prostaglandin, thromboxane, and leukotrienes. Okay, so when there's breakdown of cells within the site of injury, okay, the arachidonic acid is produced. okay, that is in this from the cell membrane, from the breakdown of those cells. So this will then be produced into prostaglandin. Okay, apart from prostaglandin, to also be to also lead to the production of thromboxane and leukotrienes. So when we look at this chemical mediator prostaglandin, it helps in vasodilation. Okay, so when there is vasodilation, it means there is high blood and increased edema at the site of cell injury, meaning inflammation is taking place, or inflammatory process is taking place. Sensitizing pain receptors also happens because of the presence of prostaglandins. Okay, and prostaglandins also stimulate temperature regulating area of the hypothalamus, and this then produces a febrile response. Okay, so prostaglandin has got those effects, may temper with the temperature regulating system, leading to febrile response. Prostaglandin increases sensitization to pain. Hence, the person who has suffered this cell injury may start feeling the pain. Apart from that, prostaglandins bring about vasodilatation. Okay, hence this will lead to edema and inflammation worsening at that area of cell injury. Okay, then the thromboxane that we have talked about. Okay, this one helps to potent vasoconstrictors. This helps in platelet aggregation factor and also helps to promote clot formation. And then when we talk about leukotrienes, okay, so they form the slow-acting substance of anaphylaxis, which constrict smooth muscles or bronchi, causing narrow airway and increasing capillary permeability, leading to airway edema. Okay, so we have talked about two phases of inflammation. Okay, so the first phase of inflammation, which we talked about, is vascular response. Then the next phase that we have talked about is cellular response. Okay, so now the next phase now that we have to look at is exudate formation. Exudate consists of fluid and leukocytes that move from the circulation to the site of injury. Okay, so about the exudate, okay, which is a product which we can look at, that is formed because of as end product within the inflammatory process. It can be of different types depending on the composition. Okay, depending on the composition of the parts that are within the tissue spaces. Okay, so there is celosanguineous, okay, exudate. There is fibrinous exudate. There is pascilent exudate from the word pass. Then there's catarrh. Okay, so exudate. Okay, so these are some of the types of exudate. So at exudate formation, we are simply looking at pus formation. Okay, so now this exudate is the end product after the infection has been fought within the tissue. Okay, the outside tissue, okay, where the injury has taken place. Okay, so when I say celosanguineous, cello from serum. Okay, so that is celosanguineous, meaning it is composed of red blood cells and serous fluid, which is semi-clear, and it is going to look pink and may have red kind of streaks. So celosanguineous, there is serous. Okay, serous. Then sanguineous, they are to do with red blood cells. Okay, so then there is the other type of exudate, which is known as fibrinous. So in fibrinous, there is excessive amount of fibrin that coats tissue surface and may cause them to adhere. Then the other type of exudate is hemorrhagic. Okay, in hemorrhagic type of exudate, there is bleeding contents that result from rupture of necrosis of blood vessel walls, okay, or that is coming because of hematoma. Then there's purulence, okay, from the word pus, okay, type of exudate. This consists of white blood cells, microorganisms, liquefied dead cells, and other debris. Okay, so in purulence here we are looking at cellulitis. Okay, it consists of white blood cells, microorganisms, liquefied dead cells, and other debris. Then there's catarrh. This is found in tissue where cells produce mucus. Okay, that is in catarrh. They are found in tissue where cells produce mucus, like when you have runny nose. So you can have this type of exudate known as catarrh, found in tissue where cells produce mucus. Then let us now look at clinical manifestation of exudate formation, or let's say clinical manifestation of inflammation. The local response that we see in inflammation is redness. Okay, so redness is because of hyperemia, okay, and also coming because of vasodilation. Okay, then because of increased blood to the area which carries with it heat. So the other clinical manifestation is heat. Heat, this is because of increased metabolism at the area of cell injury. Then there is pain. This is because of change in acidity levels at the area of injury, and also because of nerve stimulation by the chemicals. So that is why there is pain, okay, as a clinical manifestation of inflammation. The swelling, this is coming because of increased vasodilatation that leads to increased permeability, okay, and also because of the tissue slit that has happened, okay, resulting from the injury. So this is going now to bring about the swelling. Then there is loss of function or functionless. This is because of the swelling and also because of pain. Okay, so apart from these clinical manifestation, there is also systematic manifestation. Okay, within the body system, there are certain things that we see because of inflammation. So there is increased white blood cells that comes because of stimulation of bone marrow. Then apart from that, there is malaise, nausea, and vomiting. This comes into play because of anaphylactic reaction. Then there is increased pulse. This increased pulse is seen also because of an anaphylactic reaction and increased metabolism at the site of cell injury. Then there is also increased respiratory rate. The increased respiratory rate is seen because of anaphylactic reaction and metabolism. Okay, as earlier explained, prostaglandin tampers with the temperature regulating center in the hypothalamus. So we are going to see systemic manifestation of inflammation like fever because of the release of cytokines, okay, which are soluble factors secreted by white blood cells and other types of cells that acts as intercellular and intracellular messengers which initiate metabolic change in temperature regulating center within the hypothalamus. So the synthesis of pus is the most critical metabolic change which acts directly to increase thermostatic set points, okay, or bringing about the increase in temperature. Okay, the hypothalamus, when it has been affected because of the presence of cytokines and other chemical mediators, it will stimulate increased muscle tone and bring about shivering and decreased perspiration. Okay, decreased perspiration and also blood flow to the periphery. Okay, so now Let us look at types of inflammation. There is acute inflammation and there is chronic inflammation. Acute inflammation is the healing that occurs within 2 to 3 weeks and usually leaves no residue damage. Then chronic inflammation, this one lasts for weeks, months, or even a year. The prolongation and chronicity of any inflammation may be as a result of alteration in the immune response and can lead to physical deterioration. All right, so now what would be the management of inflammation? The management of inflammation may include helping the patient with analgesia drugs because there is pain, anti-inflammatory drugs because there is inflammation. So antipyretic drugs because there is antipyretic. So we have the non-steroid anti-inflammatory drugs that have got the properties that are going to help with all this. But otherwise, when you're looking at management, you have to do observation of the area for signs of infection. Temperature raise, temperature pulse respiration can be observed. So you can also observe the client if he has any signs of compromised immune system to the inflammatory process that is taking place, so that the appropriate measures can be taken. Nutrition, because of inflammation here, we are saying it should be adequate and it should contain components that are going to help in promoting healing. Rest is important when there is inflammation because you do not want to worsen the cell injury that has taken place. So it is going to help in promoting the healing process. Position here, what I can say about position in your nursing care is that compression supports the tendons and the muscle, so you have to manipulate the patient's position according to the patient's comfort and reduce circulation to the area where there is inflammation, as this will help reduce on the inflammation process. So the pharmacological part there, then it can come in where you give salicylates, you can give acetaminophen, you can give ibuprofen, as is just some of the examples. So salicylates, they inhibit synthesis of prostaglandins. Acetaminophen, they inhibit synthesis of prostaglandin. So are non-steroidal anti-inflammatory drugs. For other anti-inflammatory drugs that can be given includes corticosteroids. And then when you're talking about nursing care, and you are looking at nutrition, there are these vitamins that are of importance. Vitamin A helps to accelerate epithelialization. Then vitamin B acts as a coenzyme. Then vitamin C helps in the synthesis of collagen and new capillaries. Then vitamin D helps to facilitate calcium absorption. So you can also put in other things to do with cold and heat complex. Cold application is usually appropriate at the time of the initial trauma, as it promotes vasoconstriction and decreases swelling. It also helps to reduce pain and the congestion that may come. Remember, the initial in the vascular response stage is vasoconstriction. So when you apply the cold, you are going to increase the vasoconstriction there, and also helps to reduce the pain. Heat, on the other hand, helps to localize the inflammation agents. It helps to warm and moist the area and may help in debriding the wound site when you apply it. So the nurse needs to appreciate all these things. Apart from checking the vitals and doing all the things that we have mentioned for the patient. So in the next lesson, we'll look at the healing process. So a review of what we have just been looking at. Okay, we have been looking at inflammation. We have defined inflammation as a sequential reaction to cell injury, okay, which bring about neutralization and dilution of inflammatory agents, okay, in order to establish an environment suitable for healing and repair. Inflammation, we have said, is present with infection, but infection is not always present with the inflammation. So some of the causes of inflammation, we have said, is infection, heat, radiation, trauma, chemical, allergies, or autoimmune reactions. Okay, inflammatory response is divided into 4 stages. So we have the vascular response stage, we have the cellular response stage, we have the formation of exudate, and we also have the healing phase. Vascular response, there is vasoconstriction, okay, that come as a reaction to cell injury, and then there is vasodilatation that comes because of histamine. Vasodilatation is there to facilitate capillary permeability so that cells and other proteins can migrate to the tissue spaces where the injury has taken place. Okay, then we have the cellular response, and under the cellular response we have said the neutrophils are the first to arrive at that area. Okay, and see, they will be usually within the area for 6 to 12 days. Then the next cells that will arrive are the monocytes. Then later on we see the lymphocytes that bring about the complement system, okay, consisting of pathways to mediate inflammation and enhance phagocytosis, increase vascular permeability, chemotaxis, and cellular lysis. Okay, after that, then we looked at the 4th phase of inflammation, which is exudate formation, of which we said exudate consists of fluid and leukocytes that move from circulation to the site of injury. Here we talked about the types of exudate. We have the sanguineous, in which there is a lot of serous fluid. We have the fibrinous exudate, in which there is a lot of fibrin. Okay, then we have hemorrhagic exudate, in which there is a lot of blood that is coming from blood vessel walls, okay, or that is coming from within the hematoma. Then we have the pestilent, okay, pestilent type of exudate, which consists of a lot of white blood cells. So here is simply pus. Okay, so it also contains other debris from the cellulitis that is happening at that area. Then the other type of exudate is catarrh, which is mostly found in tissues, okay, where that will produce a mucus. Like when someone has got runny nose, you have catarrh type of exudate. Then we went on to look at clinical manifestation. So we are in clinical manifestation, we have looked at local response, and we have also looked at systematic manifestation. Local response, we talk about redness. Okay, redness here because of hyperemia and vasodilatation. We talked about heat, which is because of increased metabolism. We talked about pain because of changes in the acidity at that area, and also because of nerve stimulation by the chemicals like prostaglandin. Then we talked about swelling because of the tissue slit that is formed and increased permeability in capillaries. Then we talked about loss of function that is due to swelling and pain. So during this time, one fails to use, if let's say it's a limb that is involved, there is be reduced or restriction in movement of the limbs. Then systematic or systemic manifestation, we are going to see increased white blood cells because of mobilization of neutrophils. So the bone marrow produces a lot of neutrophils so that they can come within the blood and fight infection. We see malaise, nausea, and vomiting because of the anaphylactic reaction. We see increased pulse because of the same anaphylactic reaction. We see increased respiratory rate because of the same anaphylactic reaction, and also increased metabolism. Fever is due to prostaglandin and also cytokine that come because of damaged white blood cells. Then we went on to look at types of inflammation. There's acute inflammation and chronic inflammation. Okay, after that, then we looked at our nursing management of inflammation, of which we have said there's the pharmacological management and the non-pharmacological management of inflammation. So in the next lesson, we'll look at the healing process. From me, I'm saying thank you and keep studying.